Hi guys, in this unit we will be doing hand washing. Note that there are two types of hand washing for aseptic techniques and hand washing for sterile techniques. We'll talk about that a little bit in the video as we go along. Now the first thing we want to do is to make sure that you have short, well-kept nails. You want short, well-kept nails so that you do not hurt yourself or your client. First thing you need to do in order to get your hand washing done is to ensure that you have clean running water, a supply of soap, and paper to dry your hand with. There are different types of water supply. With this one, we have the hand lever. There is the turn knob, the knee or the pedal, and you have to be able to determine which one it is and how you are going to use it, especially if it's something infrared where you're just waving your hand in front of a sensor. Now, first thing you want to do is to turn your water on and make sure that it is a little bit warm. You don't want it hot because it's not supposed to be uncomfortable. You need warm water because warm water cuts, oils, and it makes your hand a little bit more clean. So you would turn the water on to the desired temperature, you wet your hands, you pump your soap. For these pumps, we generally use 2 to 3 pumps because we're trying to get somewhere between 2 and 5 mLs of soap. Once you've got your soap, you are going to wash your hand in a circular motion. Make sure that you hit the heels of your palm. You're washing your hands in a circular motion because the friction gets rid of the bacteria that may be on your hand. Then you're going to rub your fingers together to get the inner portions of your fingers. Your hands are going to work together to get each other clean. Now you're going to do the back of your hands, do the other, and then we're going to get those fingernails clean as well. The last step that I suggest that you incorporate into your routine for hand washing is to wash from your wrist downward. Keep in mind, I'm turned to you, so all of this is done with my wrist above my elbow. When you're washing your hands, you want your hands below your elbow. We're considering our hands to be the most contaminated portions of our arm. So our most contaminated portion has to hang lower. Now this is where it becomes a little bit different when we're doing a sterile technique for hand washing. You are going to have your hand held in the opposite direction. Because at that point, you're washing your hand in this manner so that you can keep your hand up. You are going to make sure that your hand does not fall below the level of your waist. So, you've gone through the process of washing your hand nice and vigorously. You want to spend a minimum of 30 seconds doing this. Then you come over, you grab the towel, you turn off the water. Once you touch this tap, whether it's this way or it's that way, once you've touched it with the paper, that paper is now contaminated. So you're going to toss that one and come back, get some more, and now you're going to dry your hand from the most clean, because you just washed it, from your most clean area going back to your most contaminated at that point. You are going to sap your hand dry. You're not doing that thing that we commonly do at home. You sap your hand dry because you're trying not to disturb your skin too much. You're trying not to break your skin. So you make sure that you sap dry your hand. You take more if you need to get more, but do not come from here, go here, and then come back up. You're moving in one direction. So you can start with your hand, and then you come down and do further down. So, now our hand washing technique. You turn your water on, dampen your hand, get your soap, make sure you form that lather, go in between those hands, wash from your wrist going down, and make sure you get your nails done. You keep your hand below your elbow because we're doing aseptic technique. If we were doing a surgical technique, we would be washing in this direction because we would have scrub from our elbows going down. So you wash your hand and then you turn your water up. Make sure that you do not come in contact with the faucet when you try to top that off. Okay, make sure you do not come in contact with the faucet at that point. So now you have got clean hands.